hit record. We'll get started. Hello, everyone. Thanks for joining us this afternoon. My name is Jessica Diaz. I work for the Oregon Health Authority. I use she, her pronouns. And I hope you are here for the 11:15 Medicaid Waiver Health-Related Social Needs Partner Work Session today, which is March 12th. Thank you so much for joining us. I'm going to skip over the Zoom meeting topics we just discussed. And we are going to start today with a few quick polls. We're seeking to make sure we're collecting good information on where everyone hails from. So places you live, places you work, as well as what sectors you feel your organization represents. So we're going to start out, I believe, with geography. I'm going to double check if that is the case. Yes. And so you all should have a poll in front of you that has all of the counties, including an option to say statewide, including an option to say that that is not applicable to you. And we're going to hold this poll open for probably another minute or so. We're going to see how much active participation we can get at the beginning of this work session. Now it looks like we're at just below 70%. Oh, okay. There's active movement on this, so let's hold it open for another 30 seconds, Trevor. Looks like we have many people from many parts of the state. You see, unsurprisingly, we have quite a few people from Multnomah County. Looks like up next is Washington County. We have folks from Clatsop, Columbia, Coos, Crook, Curry, Deschutes, Benton, Clackamas. We have most counties represented here, which is fantastic. Not every county, but most. And it looks like about 4% of folks clicked the statewide button. Oh, we're so close to 80%. I'm going to see if we can. And then as people join, the percentage went down. All right, we hit 80%. All right, Trevor, let's move on to sectors.
Your discussion about sort of the agenda. First, do we all agree?
All right, so this next question is, what sectors are you aligned to in your work? And we have an opportunity to identify as an internal person, so that's working for the state, community-based organizations, and community partners.
Where? What do you do?
We have CCOs, climate partners, equity partners, organizations that serve priority populations. Some folks who identify as members of the general public, healthcare partners, behavioral health, housing, local government, nutrition partners, OHP members, tribes or tribal serving organizations. Looks like we're currently 2% other. Now participation for this one's a little lower, so I'm going to give it a bit more time. And actually, I do wonder, Trevor, if we're able to share the results, at least briefly on the screen, so people can see themselves represented.
We can share results.
Awesome. We're at 75%. I believe we can get higher. I also welcome you to let us know if you feel like these do not represent you, because that's also really valuable feedback. All right, It went higher. I think we can go ahead and end the poll. And Trevor, if you wouldn't mind popping up the results for a second, I think that would be valuable for us all. And also I'm going to do a call out, which is that this is a fairly new functionality we are integrating. We just started this calendar year. So thank you for your patience as we learn the best way to get this information both collected and available for you all. I'm not actually 100% sure what people are seeing. Are people seeing the results right now?
Yes, I saw them at least, Jessica. This is Jerissa.
Oh, excellent. Ah, so they showed up, but some people might have immediately closed out of them. It does look like we're 42% CBOs and community partners. And that also includes, there's many sectors who are representing today, which is great. All right. Well, thank you all. This has been very informative, and we're going to keep practicing things like these polls as we seek to really make sure we have a shared understanding of who we are here and who is being represented. Also very open to hearing if you all think there are places we can be more intentionally engaging different sectors, different organizations, different parts of the state, all of the above. So now that we've completed our group polls, I'm going to navigate us trying to make it a practice as we start these sessions to pull up these group agreements. And I'm not going to read them word for word, but these are some that we proposed. The engagement staff worked on them. We're very open to continuing to see these as dynamic. If there are any things that you all feel should be represented here that aren't, or if you'd like us to change or remove anything, there's always space to do that as well. And I also promise this is the last slide before we get into the actual content and topics we're here to talk about today. So thank you. And I see we still have folks joining. All right. So we've gone through our introduction, we've gone through some polls, and now we're at the point where we're here to talk about today's agenda. We have 3 major items today. We have an opportunity to just make sure we're all on the same page, share very quick background, give some quick updates from the world of Oregon's 1115 Medicaid waiver. And then the main topic that we have today is a document that we are calling Member Journey. For those of you who were with us last month, we talked through a provider journey document. And this is the other side of that same sort of journey, which is what are the steps that members take when they are seeking and connecting with these health-related social needs services. And then we do have, we have a special guest towards the end of our presentation, which is there is a third party named Core who is doing evaluation work for the waiver, and they have an opportunity to actively participate in the program evaluation. And so there are a few slides and someone's going to come talk to us about that right at the tail end of today's presentation. It isn't written on here, but I would say also consider that Q&A, question and answer, is going to be throughout all of this. So if there's anything that you have questions about or you want to give active feedback on, that's another time that the waiting room is going to be a really helpful tool for us all, just because we do have over 80 people in the room, so it might be a little harder to have that conversation fully out loud, but we will save space for that as well. Oh yes, and In the background and updates, there is also an update on the Community Capacity Building Fund. So I do want to call out that we are going to be doing that very soon once I give my initial background. So for folks who have been regularly attending, I don't want to spend too much time, but I also know we have new faces every single session. So I want to make sure we start on the same page when we talk about what is kind of a lot of state jargon. You'll hear us talking about Medicaid and the Oregon Health Plan. Medicaid is a national public health program that is a federal and state partnership. So Medicaid looks a little different in every state. It has different names. And in Oregon, we call it the Oregon Health Plan, or OHP. And here in Oregon, OHP is free coverage that's available to children, teens, adults, families who live in Oregon and meet income and other criteria. There's no open enrollment period for OHP. It is open anytime during the year and people can always apply. When we talk about OHP and we talk about Medicaid, we're going to be talking a lot about what we're calling a Medicaid waiver, or the 1115 Medicaid waiver. And what we're talking about for that is that we have this 5-year process by which we take the standard set of rules that the federal government has given states in order to get Medicaid funds. And we have ways in which we want to try out doing things differently. So we can ask permission to change some of the rules within a negotiation with the Centers for Medicare and Medicaid Services, the federal government. And then we get to innovate. We get to try things that are tailored towards the specific needs of Oregon. And we get to see what other states are doing, and we can make our programs and our benefits better. And so we're in one of those 5-year periods, 2022 to 2027. And we're in a phase called implementation, where we have already worked with the federal government from this round. We have the general idea of what we want to do, and now we have to make it real. We have to implement it. And so we are actively implementing different parts of this 5-year waiver as we speak. I would call out specifically that, as I go to the next slide, some of the health-related social needs that we are seeking to work on this waiver period is the climate-related supports. Those went live this month, March 1st, 2024. So different parts are going live different times throughout this 5-year period. And we are seeking to do work that is centrally focused on creating a more equitable health system. And so that is what we are seeking to do. One of the ways that we have been given permission working with the federal government is to focus on specific health-related social needs, which includes housing, nutrition, climate, and outreach and engagement. And so we have focused on these HRSN, or health-related social needs, in past sessions in more detail, but just know that these are what we're talking about when you see that acronym HRSN, or you hear us talk about health-related social needs. And that's what we'll be focusing on a lot today as we talk about a member's experience, an OHP member's experience of health-related social needs services and how they can seek these services and the different roles that they're going to see different types of organizations and agencies play. All right, Lisa, I have a few slides for you if you're still happy to present today.
Is it so?
Great,
Not so.
thank you. Appreciate the time. Good afternoon, everyone. Lisa Croix. I use she, her acronyms, and I'm the 1115 policy advisor. We can go ahead and go to the next slide. So just really wanted to take a few minutes to remind everyone of this opportunity. The Community Capacity Funds are a fund, it's a grant fund program available to support the capacity building for HRSN service providers. So if you are considering or potentially looking to be an HRSN service provider, these funds could help you gain some of the capacity, skills, staff, technology that could really support you in those in providing those services. So the application window opened at the beginning of this month, so March 1st. All applications are due on the 31st of May. Those applications all are due to a CCO in your service area. So at the end, next couple of slides, I'm going to show you kind of where to find all of this information. It's at the web page, which is actually the second bullet. Let's go ahead and go to the next slide. I think it shows the CCBF web page. Oh, I want to go to the next slide and just show everyone where the resources are, and then we'll jump back to this one. I think it'll make more sense for everyone.
And let me just open the web page because I think
We may have cut that slide.
we may have cut the additional
Okay.
slide.
That's not a problem. I just want to really encourage everyone to go to our CCBF webpage. There are a ton of resources. It will help explain and make it clear what you can use these funds for. There are 4 different areas that these funds can support. And that's really clear in here. There's an FAQ document. There is a link to where to a direct contact at each of the CCOs. There is a CCO service map that can help you understand which CCO is in your service area. Each CCO also has a web page, and we would really encourage you to, once you identify which CCO is in your service area, really look at their CCBF web page, understand what they're prioritizing. But just really want to encourage everyone that is really thinking and interested in providing HRSN services to really look at this grant opportunity and reach out if there are any additional questions. There you go. Thank you. So here's the map that I referenced that really can help you understand which CCO is in your service area. Again, lots of resources in multiple languages. Each CCO is using the same application. That application is also linked to the webpage. So would just encourage everyone to take a look at that resource. And thank you for a little bit of time to make sure everyone is aware of this. And
this
here's
is
the
the last
timeline. Thank you. I don't think we have time for questions this afternoon, if that's correct, but happy to always follow up.
I would say this would be a great time to put any questions or thoughts that you have on the community capacity building funds in the chat. And I know that there have been other sessions where we talked in more detail about this. So we are mostly focusing on another part of the work today, but absolutely we want to have ongoing conversation about this opportunity and make sure that we get the word out there as far and wide as we can. So also we would really appreciate any additional, if you have anyone who you think might be interested in, we want them to see our website. We want them to know how to apply and feel confident about that. And I do see that there are some questions, so we will, I think unfortunately we don't have time to talk them through, but keep an eye on the chat, and I think we'll be sharing what we're able to and continue to bring that back. So thank you. And I believe Charissa, you're up next.
Hi, thanks, Jessica. Hello, everyone. Charissa Young-White, and my pronouns are she, her, hers. I am a, I guess, 40-something white woman with brown hair. It still weirds me out to say 40 or middle-aged. So I have medium brown hair. I'm wearing glasses and a blue top, and I have a wall behind me with a green sort of teal picture on behind me. I'm really glad to be here today and welcome everybody. The first thing I wanted to quickly share is we have some additional resources since we met last. And this is really centered around the waiver, health-related social needs, but especially the climate benefit that went live on March 1st, which is very exciting. If you could click on the climate benefit webpage, Jessica, we will go there. And I believe everyone gets these slides post-meeting. Is that correct, Jessica? And you'll be able to click through these links. So we're not going to go through each one. It's just a lot of resources for you. But this one is really important. This is the Oregon Health Plan Climate Supports primary webpage. So for health-related social needs. So on here, you can see what they are. There's overviews in multiple languages. You can see who qualifies. You can look at the specifics like living situations and health conditions. And then maybe one of the most important things is, how do you ask for them as a member, or how do you support members if you're a community partner or an HRSN service provider? And it'll be through their coordinated care organization, or there's a link as well to email or call the open card members there. And on the right, there are things that are important as a community provider or a member, which is a template request form that you don't necessarily have to use, but it shows you the information that you will have to provide to either the member's open card or CCO providers. We have a fee schedule, and then a frequently asked questions, which is extremely important, of course, in multiple languages as well. There is also going to be more things posted to this page, more materials and tools as we move through this process. So things like what we're going to talk about in just a moment, which is our member journey, our provider journeys will be linked, and we can, so you can come here and hopefully get to a lot of different spaces there. Other things we'll just call out, there's, as a service provider, this is not member facing, but the HRSN outreach and engagement fact sheet, which is important for our service providers to understand how they can reach out to OHP members that may be eligible for HRSN services, and how do you get reimbursed for that? How do you sign up as a provider, etc.? So members, of course, can look at it, but it's really about this process behind the scenes there. There's also a couple forms that are helpful that are linked directly here that are also linked back up from that climate benefit webpage. So hopefully there's no wrong door, like lots of ways to get to these resources as well. And then I didn't call it out, but there's a couple overall waiver links on that page as well. Yeah, you can keep on going though, Jessica. Great. So today I touched on this, and so did Jessica. We're going to talk about the member journey, the member experience through HRSN services. If you recall, I think it was either last time or it was the time before that, one of the last two times, we went through a provider journey tool that shared how you become an HRSN service provider in this PDF document with links to these resources and hopefully information that helps you help the member on their journey. So this is really coming from the member's perspective. So today we would really like you to think of a few things as we go through this journey. Does it help you as a community provider, a CCO, or a community connector, someone that's supporting members access HRSN services? Will it help understand your processes and how you can better serve members? Think about gaps, what's missing, and think about the tool overall as well. So you can think about this from multiple perspectives. You can think about it as the overall tool, like I said, each step and how it will impact the member, if members can understand it, etc. Really, any feedback that you can give is always appreciated. And I want to touch on the question in the chat really quickly. It was asked if the provider journey is accessible on OHA's website, and it is not yet, but it will be so very soon. So the provider journey and the member journey are really in their final first iteration. I say we're going to have a final version for now, but we are taking feedback. We will be making changes, and there will be additional iterations based on your feedback, consumer member feedback, and other feedback. But as housing, on November 1st, housing as a benefit for HRSN services goes live, and then nutrition in January 2025. These will also be updated to include the nuances of those as well. So you just expect this to be posted very, very soon, and then in multiple languages as well. The member journey will be in the 13 languages, I believe, in the hopes that we can reach as many members as possible. Let's see, I think that's it for this. I'm actually going to turn it over to Lily Bork. Lily worked very hard with the team to develop this member journey. And I'm going to turn it over to her to talk about the actual tool and probably give a little high-level summary first as well.
Great. Thank you so much, Charissa, and thank you all for having me. My name is Lily Bork, and I use she, her pronouns, and I support the 1115 Waiver project team. We'll actually pull up the tool in just a second, but overall, as you can see on this slide, we have 5 major paths that members will take for this journey. They will first learn about the options and get started, and then they will complete the screening process if they decide to apply for HRSN services. And then once the screening process is complete, the members will get the decision on their HRSN benefit from their health plans to actually start receiving their services. And then last but not least, we also have a section with some information about how members can get help and develop a plan for their care. So we'll expand more on that in just a bit. And for the step on getting the services, we will see branch offs depending on the type of service the member is looking for and qualified to receive. And this is where we will see differences in, for example, how to receive a device for climate services versus receiving housing support. So again, this is just a high level of the path, not the actual tool itself. But I think we do have the actual member journey that we can go through together. And thank you so much, Jessica, for pulling that up. So just very quickly throughout the member journey, just like the provider one that we presented a few weeks ago, we've built in interactive functionality so people can explore the journeys on their own. So as a digital tool, the journey includes navigation and more features to allow people to move through the journey as they will like and make their own choices about where to go next. So for example, the table of content on page 2 gives a quick summary of what to expect in the journey. The page numbers here are actually clickable so that the user can jump to any slide they will like. And then throughout the document, we've included navigation features that users can click on to jump to other pages for this easy back and forth referencing. So Jessica, if you could go to page 3, you can actually see a little purple symbol at the bottom. So text or graphics that have the symbol are clickable throughout the journey. Thank you, Jessica, for pointing that out. And then the blue tabs or navigation bar at the top of each page are also clickable. So again, we just want to make sure that people can easily go back and forth in this tool to reference the information they need. And then like the provider journey, the member journey begins with a few pages that provide an overview of the HRSN services, including page 6 that covers information about people and organizations that can support members throughout the process. But what's unique about the member journey is that we've included a page providing a high-level overview of the eligibility criteria for HRSN services, which is on page 4, and apologies for going back and forth here. But we also have a page on OHP overview, which is on page 5, in case someone is new to all things OHP. We actually have a page like this in the provider journey as well, but the content here is tailored and is more focused from a member's perspective. And I promise just one last navigation point that I want to bring up is that you will find hyperlinks throughout the journey that link to additional resources, such as the climate resource fact sheet. You will also find a helpful links page at the very end of the journey, just for quick references. So with that, could we please go to page 7? Thank you, Jessica. So this page is what you saw in the PowerPoint slide. Again, this is just a quick overview of what people can expect in terms of the steps for accessing HRSN services. The steps are clickable here in case people want to go back and forth. But after this, what I like to call landing page for steps where people can start clicking on the tabs to learn more. We do have learn about options and get started as the first step, which is the next page. And here we listed out the ways a member can learn about HRSN services and get started. They can do so through their health plan. So that will be a CCO or fee for service. I want to call that out, that we use health plan throughout because we've received feedback that this is the term that members are most familiar with when we talk about CCOs and fee for service. Just wanted to highlight that, throughout the document, we've used plain language, so it's very easy for members and others to understand and follow. But back to the steps, members can also get started on the process with providers or someone in their community that they trust. And throughout the document, starting with this slide, I also want to call out that you will see tips that people can keep in mind when navigating through the HRSN services process. So here we noted that the easiest way to get started for members is through their health plan. Next page, please.
And sorry, I might
sorry.
just make this a little conversational as I attempt to scroll, but not so fast that it becomes problematic for you all. So my apologies. The helpful tip that Lily just called out is here at the bottom of page 8. And I think most pages have a helpful tip of some sort at the bottom. Is that correct?
That is correct. Thank you, Jessica.
All right. Back to my slow scroll. Carry on. Thank you.
Thank you. Thank you so much. Then we have the complete the screening process step where members can learn to complete the screening process with their health plan. So we've included some nuances where members, for members to know that they should have documentation ready, for example, and if they will like, they can fill out a form to allow their health plan share needed information with their providers to receive services. So that's just like a high level overview. I'll pause for just a second. And then here for the helpful tip, we have that, members, if they can share documents or information that show that they're eligible for HRSN services, that can really help speed up the process for their health plan to check their eligibility. And with that, we can slowly move on to the next page. Thank you so much. We then go into the steps where members will learn about the decisions about their HRSN services, how they will get contacted, and what happens next, which includes what they can do if they receive a denial letter. So in that case, we've also listed the appeal process and also call out the HRS program if they might qualify for that. And as a tip, we remind members to please update their contact information so that they can receive their letter in the mail, and their health plan will be able to contact them.
I just want to do a quick acronym check. When we say HRS, that's health-related services, also known as flex funds within some CCOs. So there is a difference between this document, which is really focused on those health-related social needs services that are available to open card and CCO members. HRS, health-related services, has a very similar name, but has a completely different mechanism. So just calling that out. And I hope it's okay if I routinely interrupt you, Lily.
No, please do. I really appreciate that. That's really helpful context for folks. Thank you.
And I do want to actually point out, related to that distinction, is that the appeal or hearing is an important part of that, because people who meet the eligibility factors for these health-related social needs, this is absolutely something that they are entitled to, and If we click on this link, we go to the Appeals and Hearings website for OHP. There's also a really great, our OHP ombuds people are fantastic resources. And I also want to call out that I see someone asking about helping clients with the appeals process, and absolutely that is a role that organizations can help play to help people understand what their rights are and help them connect to resources. I'm not sure if that answered the question that was put in the chat, but I hope it was at least a little helpful. All right, my
Thank you,
apologies, Lily,
Jessica.
where were we?
No, this is super helpful. Thank you so much. I think that covers this page. I was going to go to the next one if folks are ready. Thank you so much. So this next section is where members can learn about receiving the 3 different types of HRSN services. So people can use this, again, what I like to call landing page, to click on the different tabs to learn more about each service type. Right now we have information for climate and housing services. And since we are on the climate services page, we can quickly go through that information. So for climate services, since it's focused on delivery and installation, we've included information about scheduling the delivery and follow-ups. And as a tip, we've included a link to the tenant's rights document for installing portable ACs, because people do have the right to install portable ACs in their apartments. So if they run into issues with their tenants, it's really important for them to have this resource, so then they can go to their landlord and make sure that they can install their ACs as part of their rights. So, and that's the climate page. And we can move on to the housing one. Thank you, Jessica. So for housing, we cover how qualified members can expect if they are, what they can expect if they're getting financial help for housing services. Their HRSN provider or health plan will send money directly to the landlord, the utility company or moving company, whatever the need is. The HRSN provider can also help qualified members communicate with the landlord, help them understand their lease agreements, or provide other services to help members reach their housing goals. And as a tip, we recommend members have documents like their lease agreements, a copy of their utility bill, for example, to help their providers make the payment and really speed up that process for them. And I will pause just a second in case we have questions coming in.
I do see a question. Let me click back to climate. A question about installation as part of the overall service. And I'm gonna phone the smart friends in this room. I believe that installation for air conditioners is included as this benefit. Can someone keep me honest here?
Yes, Jessica, this is Amelia Reynolds. That is correct. Installation is included as part of the benefit for air conditioning units.
Thank you. And then I see a question on limitations to applying. If a member applies and is denied, but then their circumstances change, would they go through the same application process again? Is there any waiting period? Do we have anyone on the line who can help us answer this question? And if no one chimes in, then I'm going to have to promise to get back to you because I don't have that answer ready. I apologize. And then I see a question about, and this is back to housing. Oh, it's very handy. I can click through this. About how much rent or utilities can be covered. And I believe that that will actually be an upcoming topic or series of topics that we'll be able to bring here. So we will come prepared with more details in the near future, but I think we are, oh yes, and I have confirmation that we're not 100% ready to have that full conversation today, but that folks like Callie are hard at work on that, and we will be bringing that more intentionally to the group soon. And I also see a question about plexiglass use, and I'm not sure, is that as it relates to the climate benefit? We'll investigate. We'll investigate separately. Thank you so much. I wonder, Amelia, if I can ask you to chime in again, if there is anything related to plexiglass use for the climate benefit.
That's not something that, yes, sorry, this is Amelia. That's not something that we necessarily dictate at the state level or in our guidance. But that would be if there's building policies or things that exist, those need to be followed. But the tenant right to cooling would cover a lot of like what is it allowed to be pushed back on? So it needs to be like safely and securely installed, have access to consistent and safe electricity. So a landlord per se can't say like, no, you can't install this. But if they were installed with say cardboard or is not sufficient or might be risk of falling, like there still are safety limitations associated with the install. But I think that's something that would be determined at the individual level of what is the specific building regulation as opposed to at the benefit level.
Thank you so much. I do see it. I wonder if, I think I'm going to propose this, which is we only have a few more pages. So we will go through the rest of the pages here. And then I am seeing questions about going back to different parts of the document. And so maybe that's a really great next step. Lily, does that sound good to you?
Yeah, no, that sounds great. I figured that was my cue to continue.
Yes.
So we
Thank
can
you.
go to page 14. So we'll skip nutrition. That information will come in the near future. So we'll update the journeys when we have more information about nutrition services. But in terms of steps, last but not least, we have some information that members can reference so that they can get help if their equipment doesn't work, for example. Again, this information is very focused on climate for now. We'll have more information related to housing and nutrition that we'll be adding to the member and provider journeys later. But on this page, we also highlight how members can work with their health plans to create a plan for their care needs and what that process could look like so they can have a comprehensive care plan. So that's the last slide. But as I mentioned earlier, we do have one last page where we list out all the helpful links and helpful information for members to access. And they can learn more about HRSN services and apply. So for example, we link to the HRSN request form for everybody's easy access. So if they're ready to apply, they can just click on that link and go to that form and work with their health plan or a community partner to start that process. So yeah, so that's the member journey. And I know we have a few more questions to answer. So thank you all so much for having me.
Thank you so much, Lily. And I also saw this is perhaps timely because there's a question about the various links that we share here and how we can best get that to you all. I have a question for our internal folks on the line. Are all of these links currently live to websites that are accessible on our public site?
Yes.
Awesome. In that case, I think I'm going to go ahead and make a commitment to when we send out our follow-up email that has the resources, things like the recordings, we can make sure that these all get to you in that email as well. So look for that very soon. And know that this document is a document that is meant to be a tool for you all to help you walk people through what they might be able to do and how they might be able to receive health-related social needs services. And so this is also a resource that the intention is that it becomes available to you very soon and is something that you will have access to. I'm wondering if me seeing Charissa, yep, happy to let you talk next.
There. Nope, I just saw some questions in the chat and then some answers. And so I wanted to verbally speak the answers, especially as this is being recorded and people might review it later. So as I was looking at the chat though, there was one question that I don't think we answered specifically. Do we help clients with the appeal process? And I wanted to call out that you can, and I believe that that is here on the list. It's the fourth from the top there. And absolutely can help your your clients, OHP members with their appeals and hearings, certainly. And then I think it looks like there's some housing specific benefit ones Kelly addressed. One that said, we are still developing the fee schedule for HRSN housing. The HUD housing, I don't know what HUD stands for. I'm really sorry. So I'm using an acronym that I'm not spelling out. HUD market rates is the guidance, and that's from our housing lead on the HRSN team there.
Is it housing and urban development?
Thank you. Thank you so much. I knew it at one point, but it's become very widespread to say HUD, I think. And then Pierre, I will come back to your question really quickly. There's another one, Bethany, for help with housing, phone bill and costs for cell phones. Again, the housing benefit will be released, or not necessarily just released, but discussed again at a further meeting, but I wanted to call that out. And Jesse answered the question on limitations in regards to applying. So it was asked if, for example, if a member applies and is denied, but then their circumstances change, can they go through the same application process again? Is there a waiting period? And Jesse responded that there's no waiting period. If circumstances change and the member believes they're eligible, they can reach back out through that appropriate process, the CCO or the open card, and request HRSN services. Jesse also said there may be an additional path through health-related services if they are denied for HRSN services. So as you support your members, keep that in mind that if they are denied for HRSN services, there is a possibility that another funding stream, another pathway would be available to them through their CCO. So that part we can hopefully bring back again, I think, on the health-related services, but that's an important piece there. I agree. HRSN is not the only thing that is supporting members with these type of social needs. There are other ways, but this is one that's really great because it's going to be operationalized through open card and CCOs.
I proactively brought us back towards the front of the document because I was anticipating us probably going to the question on screening.
Yes, let's go back to the screening process. And I just put that one last simply so you wouldn't have to navigate around. So someone had a question, can we go over the screening process again? So anybody on the member's care team or a family member, a parent, guardian, themselves, a friend, can help support members requesting HRSN services. So you can refer them, help them fill out the HRSN request form that Jessica is showing right now. You may not see this form and it's exact. It may not say Oregon Health Authority on the top. Maybe different community partners might use their own form, but it should have this information in it. So this is the request form to help support members figure out if they are eligible for this. So this is specific to climate supports and devices at the moment. We will have housing and nutrition as that comes about. But this form here goes through all of the ways that you can qualify. Sorry, just had a little tickle in my throat. So as you can see, Oregon Health Plan or if you can't see it, actually, I'll explain it. There's a lot of member information that's required. We don't actually have to have the Medicaid or Oregon Health Plan ID. It's just really helpful for the CCO, open card, or care coordinators to look up a member. But you do have to have a couple things, certainly like name or date of birth, so they can identify the member. There's a lot of information here, preferred language, preferred written language and spoken, which is really important if we need translation or interpretation services. Other ways, the best way to contact you, etc. And then as you get further in, you get to the details of the member really wants, I'm going to go with air conditioner because that's kind of I don't know, it's a big one. It's been a big one here the last few years as our summers have gotten hotter. And I think we had it's been the hottest weather was like in June, maybe in the last couple of years, I heard, which in my childhood, it was like, it didn't even get warm till July. So I think air conditioners are kind of a hot button one right now. So if a member is, has a home or is living with a friend, but they have a health condition like asthma or something that really impacts the way that they experience, air conditioning, heat, extreme heat, then absolutely they request the air conditioner. And then it goes into section 2, where this is part of the screening process, but the member doesn't have to necessarily say right off the bat, yes, I am one of these populations. Yes, I know I am I don't have a regular place to sleep, but are the eligible ones here? I'm staying at someone else's home, etc. But this is really helpful for the care coordinator on the other side to go through this. So if you're a community partner helping someone fill this out, it could help the process move on a little bit quicker. They have to have this health risk, clinical risk factor. So there's a long list here. It's a lot. Anyone that's pregnant, though, anyone younger than 6 years old or 65 years or older, they fit the definition for the clinical risk criteria. So that is really helpful to sort of limit this population right away, or not limit, but open it. Say, okay, I know they're eligible. Let's check that box because they're a very young child or 65 years or older or pregnant. And then there's some health conditions listed there. What's really important is what Stephanie asked in the chat. I think that's an extremely important piece. Will the CCO further research the member's medical eligibility, such as have a provider attest rather to their condition? And actually that is not required. Self-attestation by the member is all that is required. The only reason a CCO would look farther into their claims or records if they had reason to believe that a member it might be mistaken on it for some reason. Self-attestation is really important here because we want to make sure that we don't put up barriers for the members receiving this. If they attest to being pregnant or having one of those health conditions, then we are all set there. Section 3 on here is the organization. So if you're a community partner and you're supporting the member, putting your name here, it's really helpful because that means you can be a part of the care team. You can help, well, not that you can, because you could anyway, but it allows the CCO to know who the people are that are helping out their members and really work with you as a care team and maybe even part of the patient-centered service plan, like a care plan for them. So that's also a really important piece to make sure that we have all the right people at the table helping support our members, right? And making those connections.
Absolutely.
So I think hopefully that answered the screening information there. If not, please continue to ask questions.
And this may, I'm saying this for myself, and I'm hoping it helps you all as well. There are these different places to mark yes. I believe for someone to successfully get connected, they have to say yes in the health conditions and history section, in the circumstances section, and they have to have a need and mark yes to at least one of these devices. So you have to need what we're offering. You have to fit into the population categories for those transition populations, and you have to have that clinical or health related need as well. Is that correct?
Absolutely, as well as, I like this here, making sure that folks can safely use the device and they have the power capabilities, so plugging it in a space is also an important piece.
I do see another
And-
question. Oh, sorry, go ahead, Teresa.
Yeah, I was looking at that question and I'm not 100% sure if someone else on the call or Pierre, if you'd like to speak up and ask the questions. I'm wondering if you mean like reaching out to folks on a sort of widespread or community level for eligible groups. And if that's the case, CCOs and other partners can outreach to members that are presumed eligible. So someone that is thought to be in one of the groups, or the member in past touch points with the member has said they are part of one of these groups and they are an Oregon Health Plan member, of course. They can do more widespread outreach to those first, or proactive outreach, so the member doesn't have to fill out the form first. Hopefully the CCO or community partners can reach out to them. But I'm
No,
not
the
sure.
question, sorry, the question was more about if a member is wrongfully attesting that they're part of one of the population that are eligible, or makes a mistake about that, understanding the population groups. How is that being monitored?
So that would be included in the CCO's policies and procedures. They are not required to go talk to the member about the self-attestation. I know that's the truth. I wonder if Amelia or Jesse, I'm pretty new to OHA, and I think the nuances of this question are important. And I don't, so if Amelia, Jesse, Lisa, anybody else on the call wants to answer this one, that would be really great.
I can take this one. Thanks, Teresa. Hi, Pierre. Thanks for the
Hey.
question. So in terms of the CCO contracts, we've included some language around the CCOs within a reasonable period of time obtaining the information to determine eligibility, which includes member attestation of some of these eligibility criteria. If there is no indication or evidence to the contrary that the member is not in one of these HRSN covered populations, then we are expecting that the CCO accept that attestation for determining eligibility. So if, using the information that they have with either in their claim system or other information they've obtained to make that determination in a reasonable amount of time. So it's there is a lot of flexibility in the self-attestation. We want members to receive the services. We want this to be done in a trauma-informed way and not having to, sort of chase down the member and get this information from them and have them go to a provider to document all of these things. It's there is a level of attestation that we're incorporating into this. So does that help answer your question, Pierre? Do you have any follow-up questions on that?
No, that's great.
Okay,
I like that. It's so easy.
wonderful. Thank you.
Thank you so much for the question. It's extremely important, and Jesse for jumping in. I don't see anything else in the chat unless I missed anything, so maybe a quick pause if there are any additional questions.
I think there is one that I'll say out loud because it's in the chat, but I'm not sure we said it out loud yet, which Jesse has helpfully chimed in to clarify and confirm that we are aiming to have the provider journey document that we shared and walked through last month online by the end of this week. So expect it very soon. And I will add that whenever it comes out, we will either, whether it aligns with our follow-up email or our next invitation, we'll make sure you all get it as part of the body of one of our upcoming emails so that we are really pointing you directly to it and not making you go check on your own to see if it's arrived yet. So we can help with that, absolutely.
we're pretty excited about both the provider and the member journey. So I think there will be widespread sharing.
Absolutely.
Anything else on the member journey, member experience?
And then I was just realizing we went through some of these pretty quickly. So I'm just gonna pull up and just rest for a second longer on some of these slides from the beginning.
Yeah. And then this is a really great question in the chat. How can we protect against HEPA violations as we provide service to clients in a shared work environment? I cannot answer that. I wanted to call that out. And if anybody on the phone would like to help with that one, that would be great. If not, we will bring that back.
I'm wondering if this is either an acronym I don't know, or it might be HIPAA, HIPAA, HIPAA violation, so protecting health information.
Oh, and it could be, Caleb, you can clarify. I thought that HEPA had something to do with air conditioners and air quality, but I could be wrong on that too.
Oh yeah, HEPA filter is a, oh sorry, Caleb, which did you mean? Just so we correctly get that.
Okay.
Okay, so HIPAA.
So HIPAA, Health Insurance Portability and Accountability Act, HIPAA. Thank you for that. I thought, well, either way, you could have questions about that. Client confidentiality of protected health information is, of course, a priority for the Oregon Health Authority and for anyone that we are connecting with. If you could go to the last page, Jessica. We provide a resource called the Information Sharing Authorization Form. This is under important resources here. And this is not required for community partners to fill out. CCOs are likely to or may want to fill this out with their members and with community partners, but it's intended to be supportive to help get the members' consent to share their information with their health plan, whether it's Open Card or the CCO. So it talks about health-related service needs. It is, again, intended to be member-facing, so in plain language, as much as possible. Some of this language does get pretty difficult, even HRSN as an acronym. Authorizing to share health information, to determine eligibility, to get access for HRSN services here, and then to go as far through the process as payment for a community partner to get paid for these services. And it goes into details on the type of information that will be shared and what can be shared. And then the member will sign this at the end, and you can share this and keep this for your records as well. There's a lot of discussion around HIPAA as far as this goes. So again, I don't want to be the only person answering this. I just wanted to share this as a resource. And if anybody else would like to jump in and talk a little bit about HIPAA as it relates to HRSN services, that would be great.
This is a place where I know just enough to be dangerous. I know that there may be some differences in how different CCOs are interpreting compared to what we at the state have set up, but that we do take protecting people's information and offering that confidentiality very seriously. And we do want to make sure we have multiple mechanisms in place.
Absolutely. HIPAA does allow for sharing information with various partners for the member's health for care coordination purposes, and that's pretty well lined out in this document as well, and who and how it can be shared with. So I think this is an important resource. Any further questions on that? Let us know and we can come back with that. I know that we have this covered, or will have this covered rather, in some technical assistance webinars as well, so we can get into more detail probably at another time around that. So keep an eye out for that on an upcoming agenda. Will the first two eligibility questions remain the same for housing or nutrition support? So I will say that absolutely the person must be an Oregon Health Plan member to receive these services. So that's the first question. right? The second eligibility question, I think, would be if they are a part of that population. And Shauna, if I'm misspeaking with what your question is, please let me know. And the population served through HRSN services, climate versus housing versus nutrition, could be a little bit different. So there's going to be a lot more to come on that, because the different services might impact certain populations a little bit differently in the way they're carried out. So yes, they must be an OHP member, but no, the eligibility in the population could be nuanced or changed a little bit, and we'll be sure to bring that back and discuss that here. The concern about Google Sheets or other shared documentation platforms is real. I think that's probably a conversation to get in on another day as far as community information exchange platforms and the way you share information. So I would have to defer that to probably a technical assistance webinar where we can discuss those as well. So more to come on that, unless anybody would like to provide any information on this call. I know we set aside quite a bit of time to talk about this, so I don't think we're in a huge rush. We wanted to make sure and really get to these questions that y'all have. So.
I do want to just say out loud that the use of technology and questions and concerns around it, these are such important questions. So even if we don't have the ready answers today, really appreciate you continuing to bring them to top of mind. I know there's a lot that we are seeking to get information out about, and also to have these conversations and build together. So there's, even if we're not able to give you anything definitive today, it's still very valuable, and I want to thank you. There are so many things that we need to come back and bring you and to continue to build out, and so we will do our best. I also want to apologize for anyone who just saw me like suddenly jerk across my screen. It's because my cat was tangled in my headset wire, so that was a little embarrassing, but I'm fine and she's fine. So I just wanted to say that out loud. I think we might have gotten through all of the questions that are currently here. I want to double check. I don't think I've seen any hands raised, but I've also been in more documents than I usually am, so I might have missed it. Did anyone want to speak out loud on any of these points or anything else? All right. And I do believe I saw our special guest from our evaluators has joined us. So I think that is our final topic for today. So maybe I will navigate us there next, knowing that, of course, if anything comes to mind, please continue to use the chat. And I will get us back to our slide deck. And just do a quick mic check for Lisa Angus. Are you our speaker?
I'm your speaker. Can you hear me?
I can.
Great, you can hear me slightly post-cold. Hopefully it's all right.
You're coming in loud and clear, and the slide may look slightly different from when you sent it our way, but this is the beginning of the slide content that we got from you all.
Perfect. Could we jump to the next one then? And for everyone, hi, my name is Lisa Angus. She, her pronouns. I'm a program director at CORE, which is a Center for Outcomes Research and Education. We are housed within Providence, but we're independent. We do all of our own work on grants and contracts, and we do a lot of work around evaluation. And we are lucky enough to be involved with planning or designing the waiver, the evaluation for this 1115 waiver. So we just have a few slides really quickly to hopefully reinforce a message that I'm hoping a lot of people attending here today have already received about the opportunity to provide feedback on draft evaluation designs. Excuse me. Just as a tiny bit of background, For those who haven't heard this already, it's a standard requirement from the federal government that each state gets an independent group to evaluate each 1115 waiver. And CMS, the federal government has a set of evaluation requirements, and they often set out questions that they would like answered. And importantly, CMS has to approve the plan or the design, they like the word design, for evaluation from each state. So in this case, OHA has contracted with us at CORE to develop the evaluation design, so the plans for evaluating all parts of the waiver, health-related social needs, continuous eligibility, new provisions around young adults with special health care needs. So CORE has been involved in working hard on drafting evaluation designs that will eventually get submitted to CMS. And then later, the state will select one or more independent contractors to carry out the approved evaluation design, and that may or may not be CORE. Next slide, please. So as I said, we have drafts of evaluation designs in 4 different, just to make it easier to digest, in 4 different areas. So they're currently divided up into continuous eligibility and the temporary Medicaid expansion that is in place until the bridge plan is effective in the summer. Section of evaluation design around the young adults with special health care needs portions of the waiver, evaluation plans related to the health-related social needs benefit and coverage, and then a 4th bucket of evaluation plans related to costs and sustainability. So all those drafts are out there, and we are seeking and very interested in everyone's feedback on those drafts. And between now and a couple of weeks from now, March 25th, we have, there's a lot of links on this slide. What we have is a full document for each of those sort of topical topics for evaluation design, but some of those documents are super long. CMS has a lot of questions and has a format for submitting these evaluation designs that requires a lot of detail and a lot of repetition. So if you don't want to read a giant document, you can also refer to these shorter summary slide decks that we've put together, and those are available in both English and Spanish, and someone is very helpfully circling those on the screen. So there's the short takeaway from this slide is eligibility designs. There's 4 different ones of them at the moment on different provisions of the waiver, and you can review either a full draft of evaluation, potential evaluation plans, or a summary. And if you, we don't have the full drafts translated, unfortunately, but we do have the summaries in Spanish. Next slide. And then if you review any of those documents and have additional suggestions or questions or feedback, there's a couple ways to provide that. One is there is a form that just asks for some reactions. That's available in English or Spanish. The links are on this slide. So you can use that form and answer as much or as little in it as you're interested. You can say my comment is specific to this part of the health-related social needs draft evaluation plan, or my comment is broadly about all evaluation. Or if it's easier for you, there's an email address that you can send free text your thoughts to those to that email address, any reactions you have. And we welcome all sorts of feedback, including additional questions that you think need to be part of the evaluation, comments or suggestions around methods or outcomes or data sources, anything like that. Yeah, and the links should be available in a few different places, and I'll one place that has a link further in this slide. The folks at OHA kindly sent around an email to everyone who had registered for this webinar as of, I think, last week. So there may be, timing wise, you may or may not have received that. At CORE, we had a great big list of interested parties that we sent around an email to, who did include some previous registrants for both this webinar series and the OHA's All Come webinars and Para Todos webinars. I'm happy to send a direct email to anyone who hasn't received one of those. And then when we get to the last slide, there's a single page that you can go to that has all these links as well. Oh, yes, thank you, Jessica. And the links will be available in the follow-up email. One more quick slide, just to give everyone an idea of where we are, a timing, that box in the middle of the screen with a green square around it. So we're here at the end of February, early March, sharing draft designs for feedback. We at CORE need to get all the feedback in, both from OHA staff and from interested parties broadly, and update the evaluation designs. They need to go back to OHA for some final review, and then OHA needs to get those evaluation designs to the federal government by the end of April. So that's why we're working on a pretty crunched timeline. After that point, CMS has a period that's undetermined for feedback. So we wait for the CMS to review. And then at that point, the state has 60 days to make any updates or responses to CMS's comments. So we can't say right this second when the designs will be completely final. It depends a little bit on how long CMS takes to review. In the meantime, once the designs are in, OHA and CORE are going to continue talking to folks about how people might like to be involved in the waiver evaluation as it rolls out. So once the plans are in place, what OHA is interested in setting up a structure for interested party engagement and involvement in the evaluation all throughout the waiver. And then, okay, one last slide. So here's a couple other places you can go for feedback. If you visit CORE's website, especially the blog link down there has a link to a lot of all the resources that I've shared today. The email address that we are accepting feedback or any kind of questions at is at the top there. And my email or my colleague Maggie Weller's emails are there as well. If you have additional questions, we are open to all those methods of communication. That's all I have. Thank you, OHA folks, for letting us jump in your webinar.
Thank you so much, Lisa. I want to pause and see if anyone has any additional questions or thoughts to share with Lisa and the rest of us. I also want to say that I really appreciate the interactivity, the fact that you all return to us and are engaging with us here. And I know that we have a lot of different asks of your time and a lot of different things that we're excited to share with you to get your feedback on. And so we will try our best to make it apparent what those opportunities are without overwhelming you, but definitely want to hear from you all about things that you want to hear more about. And absolutely, if you are ever feeling overwhelmed, also want to hear that. And thank you so much, Lisa, for putting the direct link into that blog. But yes, thank you. And this really does round out our prepared content. We have time. We have time for maybe us to talk less and you all to talk more. If there's anything that you all want to be focusing on in the near future, things you want us to go get answers on. I do, let me double check. I think we have a lot of things that are coming up, and some things that we have recently done. For instance, we helped put on a technical assistance training session that you all were invited to, and that's slightly different from our work sessions here in that it was extremely focused on systems and forms and the steps involved versus these larger questions about what we're making and why and how we're seeking to align them with the work that you all do. So I also want to open up if there's anything that came up for folks who were in that training session that they want to learn more about or that they have questions about. I'm not sure if we have anyone currently on the line. I know there's another training session coming up. Is there anyone on the line who can speak to the early April training session? And yes, we are recording.
Hi,
Sorry, go
Jessica.
ahead.
It's Mary Durant. I'm not
Hi,
positive I
Mary.
can help, but I might be able to.
I am so glad you're here. Is there anything that you can tell us about, I think, is it April 4th is the next training session? Is that correct?
It's April 4th. And I think the hot topics we're going to cover, at least so far, are related to completing the documents. And now I just lost the name of the document, but the document that has to be completed, I think you talked about it a bit today, but going into some depth about how to get those completed. And then some work on outreach and engagement and how the billing works. And then potentially the web portal, the eligibility verification system that will be made available to enrolled providers.
Thank you so much, Mary. Yeah, and I think if there's one thing I would point out as to sort of two complementary things that we're doing, the look and feel might be a little different between the trainings, which are really focused on that technical know-how, access into systems, in-depth review of forms. And then we are going to seek to continue on the work session side to bring some of those bigger picture, like even now when we went through a document, the frame that we were really hoping to have a conversation around is how does this form that this document, the member journey that we've made, how does that relate to how you currently do your work? Do you see it as being a helpful tool? What are the things we can do to make it more helpful or to answer maybe questions you still have? And so we will continue to be focusing on a whole range of topics in the near future, things like making sure we are sharing service definitions, fee schedules. I think I saw a specific call out to talk more about the reimbursement model. Oh, I see a request for HIPAA training. Thank you. And so we'll be trying to find spaces where we can share the right information with the right folks at the right cadence. And so.
And Jessica, one
Yeah.
other thing I wanted to point out is we're looking at the opportunity to create some smaller module trainings where it might not be done live all the time, but we might create and make available some modules related to some of the things that folks might not need to know today to do today, but they'll need to know in a few months. So having that module available, they can go look at it when it's applicable, rewind, hear it at their own speed, and then potentially ask us any questions after that. So we're definitely looking at that opportunity as well, looking forward for those smaller bite-sized modules.
Thank you so much. And I'd also invite folks, if there's anything that fits that small focused module format, anything that is coming to mind for you all, please put that in the chat. And I would love for us to begin mapping things, not only based on what we are anticipating from state level that you will need, but to be responsive to needs that you all share with us. Absolutely. And I do see a call out that there's at least one person who is excited about the modules and thinks they will be very helpful. I agree. I think this might be the first time we're not using the full 2 hours, which maybe is a sign of growth and that we're not throwing too much at you all at one time. I have an incomplete, I was realizing the April 4th session is not on this slide, but I'm making a lot of promises for our follow-up email also to make sure that you all have information on upcoming sessions, whether they are trainings, work sessions. Just a quick shout out that we continue to offer a monthly webinar that is made not only for our partners and our folks who are in the health related social needs spheres, but for everyone. And so those happen monthly. They are called All-Com webinars in English and Para Todos in Spanish. And starting this year, we are offering them on the same day. So March 20th is the next monthly webinar date, the one that's it's mostly informational for all audiences. And English will be in the morning and Spanish will be in the afternoon. And that is a format that we're seeking to move forward and just have the next 2 months of dates listed here. And you probably either recently got some information about those webinars or will see more information about it as we follow up. But that's another opportunity. So work sessions, technical assistance and training, informational sessions. We are seeking to get as much information shared, discussed. We want to hear from you. We want to share what we know with you. So you'll see lots of opportunities for that. And then another plug for we have an external newsletter as well that that is also a really great place to get information, to be aware of the different opportunities. We didn't click through all of the new content, but Charissa did mention that in addition to that new climate page, we also have a new health-related social needs landing page that really focuses on that part of the waiver. And there is also that dedicated website to the community capacity building funds. So those are just a few examples of websites that continue to, some are brand new, some are newly updated, and we do make sure that we are continuing to build out those resources for you all, whether they're in website format. We have a lot of fact sheets, frequently asked questions, things like this that you're in today. And so there's all sorts of ways that we are seeking to get information out, always interested in learning what is resonating, what isn't, what you're finding useful, if there are things that we can improve. And I've been talking a lot, so I think this is the part where I'm going to say thank you. I'm going to hold this space open for a few more minutes to see if people have any other questions, concerns, thoughts that they want to make sure are recorded. And if we don't have anything else, then I don't need us to hang out for the sake of hanging out. We could end a little bit early. Thank you. Really appreciate you being here today. Both folks who are live, folks who are listening in perhaps at a later date. I want to thank our interpreters, our captioners, our presenters, and our helpful folks who maybe did or did not know they would be speaking out loud to give some information. And everyone who asked really great questions and shared their thoughts, or who are still taking it in and will have more for us. You know how to reach us, and we'll see you next month, if not earlier. Thanks all.